So the majority of reported COVID deaths is observed among the frail elderly, particularly nursing home residents. So the obvious reason is that the number of infected cases was very large because of a highly contagious Omicron. So even if the case fatality ratio is declining, the death figure gets larger if there are so many cases. But more fundamentally, there are two major issues here in Japan. One is that so-called COVID deaths include a variety of causes of death. Firstly, direct deaths from COVID, such as severe pneumonia, which were dominant at the time of Delta or earlier COVID variants. But secondly, indirect COVID deaths, which is more dominant right now in Japan, the deaths from other causes, such as Alzheimer's, where patient condition got worse due to COVID infection. And finally, deaths from other causes, but patient happened to be test positive at the time of admission. Then again, I suspect that the large share of COVID deaths in Japan is indirect COVID deaths, observed primarily among the frail elderly who have underlying medical conditions. So the condition in terms of COVID death rate is improving substantially due to vaccination and natural infection so far. But, particularly highly contagious Omicron hit the nursing home resident. That is causing a large number of deaths.
And what other factors are contributing to higher infection rates in Japan? For example, the reopening of borders or the particular season that Japan is in right now? What effect have they had?
I think it's a mixture of seasonality, but also the waning antibody from the vaccination and also relatively a large share of uninfected people. So I think these factors contributed to the large number of infected cases with Omicron.
Well, COVID is still a Category 2 disease in Japan. What does that mean in terms of being able to treat patients with the virus?
So the law defines COVID-19 as Class 2 condition, which must be treated at designated hospitals, such as acute care hospitals. But right now, what we see, the majority of casualties among the frail elderly. So those people should have been treated in the community at local medical facility. But under the current classification, the Class 2 category should be treated at designated hospitals. Therefore, these nursing home residents need to be transferred to the acute care hospitals, which will really overwhelm the healthcare system. So the government is now considering to change the category of COVID from Class 2 to Class 5, like seasonal flu.
Do you think that needs to happen soon? I understand the government is saying that might happen in May, but you're calling for COVID to be downgraded and treated as a form of flu already.
I think so, because our estimates suggest that Japan has already acquired immunity through vaccination and natural infection up to 70% of the whole population. And also the case fatality ratio is rapidly declining. So COVID should have been treated like flu. Of course, the COVID is different from flu or common cold, but the way COVID behaves right now, the medical community could have treated COVID like seasonal flu. So my opinion is that COVID should have been downgraded to Class 5 much earlier.
What are your thoughts on the trajectory of COVID in Japan from here on?
So the announcement by Prime Minister Kishida that they will downgrade COVID to Class 5 means that Japan will officially announce that the COVID pandemic in Japan will be over. So I think that Japan will now shift to the endemic phase, where the COVID will circulate in the community, so we have to live with COVID.
Well, tell us a bit more about what the community's attitude is to COVID in Japan right now. Are people comfortable returning to normal life?
The people's attitude are mixed, obviously. So many think that it's a good news that the government will announce that the pandemic is over, whereas others are very concerned with lifting all restriction because, if you come to Tokyo, almost everyone wears masks right now, so people are a little bit hesitant to change the behavior. And also medical community. Some of the medical community people are concerned because the class 5 disease, particularly local health facilities, clinics, they might be overwhelmed because the current classification under class 2, COVID are treated at designated hospital, but when coming downgrade to class 5, all the medical facility basically need to take care of COVID patients. So some people consider that they are not well prepared.
Dr. Shibuya, thank you so much for your time tonight. We really appreciate it.
My pleasure. Thank you.